Surgery, the chance of success is 76%. If people came to us for brachytherapy and body radiosurgery, the success rate is 90%. So you're talking about 18% more men. There's 200,000 men a year with prostate cancer. It means 36,000 more men lives saved if they came to us and had sophisticated radiation,
right,
which we've done for 20 years. We have a long track record. We know about it. We've done it to thousands of men successfully. And we have an 18% success rate for the people with PSA 4 to 10. So I think it tells you, number one, when the surgeon pushes you for robotic surgery, you may want to say, hey, maybe I'll call Dr. Lederman.
Right, let's take a step back here. And
just get a second opinion.
Yeah.
We've got a whole booklet which we send to men and to anybody, if wives are just as important, called Prostate Cancer, and we send it free with a DVD if you call us. And you're welcome to call the number here at ABC and leave your name and number, phone number and address, and we'll send it. Or during the week, call our office, and we'll send you the free booklet. But I think it's really critical to know what's going on to your body before prostate cancer treatment and not after.
Certainly.
If you have a PSA, let's say, high risk, 20 to 50, the chance of being cancer-free is only 44% with surgery. So the vast majority of men have recurrence of their prostate cancer. Our data is 66% better.
Wow.
So it's really very important.
That's a significant difference, yeah.
For prostate cancer and most cancers to get a second opinion. Find out what's going on first before you get caught up with the big surgery and all the risk involved with surgery.
Yeah, certainly might be a good idea to see a few different doctors and really kind of get a grasp of what's going on.
Well, almost everyone sees a surgeon because the surgeon does the biopsy.
Okay.
So almost every man with prostate cancer sees a surgeon. So in a way, they form this bond between the biopsy and talking about options. So the surgeon is the first one. But for men with prostate cancer, I would tell you, just say, okay, I'm happy to listen to you, but I want to hear about other options.
Yeah.
And it's your right to have other options.
Certainly, yeah. I'd want to know.
Yeah, I'd want to know. So we're going to go to our commercial break. We have a great sponsor with a great voice. He's going to tell you a little bit about his program.
Sounds familiar, huh, Doctor?
Yeah, I wish I had his voice so beautiful as his. And we'll be back to take your questions. We're live at ABC and to talk about more cases. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Yes, we're back. We have other things to talk about besides prostate cancer, but prostate cancer is always interesting because so many men are affected and families are affected, so I want to talk about some other topics today.
If you have any questions, why don't you give us a call here at the studio? The number is 1-800-848-9222. Again, 800-848-WABC, 9222.
I think most people are bashful to call.
I think so too, Doc.
I get a lot more calls during the week.
That's okay.
Anyway, we had a gentleman who came, and I told him I'm going to talk about him today. He's a very nice man, businessman, worked for a science company, and very fair-complected. So he came, his wife came, his daughter came, beautiful blonde with blue eyes, and had a very extensive squamous cancer of the skin. And we actually treat a lot of skin cancers. In certain parts of the world, it's an epidemic, and in the United States, people have more leisure time and probably more time to get sun exposure.
Right.
Although he and his family said he always wore a hat and had sun protection. Most people's sun damage is actually before the age of 18. When we're little kids, we're running around, and then afterwards we get smarter and wear hats and sunscreen, but the skin remembers.
Right. You forget, but the skin remembers.
You forget, but the skin remembers.
Certainly.
So this man had a very extensive squamous cancer of the right forehead area going in the hairline. He had attempted surgery. So right through the middle of this tumor, if you can imagine a tumor the size of almost like your palm, and the surgeon cut through it and I guess saw that he couldn't remove it all because there wasn't enough skin to close it. The skin on the forehead is pretty tight.
Sure.
So he opened it and closed it, and the patient came to us, and we're proceeding with hyperthermia. Hyperthermia is heat treatment. It's been known since time of Cleopatra to help cure cancer or treat cancer, and we're using external radiation, and he's getting a series of treatments of hyperthermia and radiation for his squamous cancer of the forehead. And we treat a lot of cancers of the skin, especially around the eyes, nose, mouth, and ears.
Sure.
Because number one, radiation is very effective, and number two, it helps prevent damage to the healthy tissues as far as the topography, so there's not distortion usually of the skin. So radiation is a very nice way of treating skin cancers. We use radiosurgery, which is very focused, so we're able to aim the beam at the cancer. And sometimes we'll use hyperthermia also to try to enhance the effects. We're one of the few centers in America that has hyperthermia equipment. We have a couple calls. We're going to take first one from Robert, who's from Whitestone. Good morning, Robert. Good morning, Robert. Can you hear me? Okay, I can't hear you. So let's go to Dr. Eisen.
Hello?
Hi, this is Robert. Can
hey, Robert.
Hi, can you speak up? I can barely hear you.
Okay, I think we have a bad connection. I'll speak
probably
as loud as I can. I have a question. I was diagnosed with prostate cancer early in May. I had the radiation treatments. I went for my first follow-up yesterday with the radiation oncologist, and he said the way he's going to track the illness is by a relative decline in the PSA. My PSA was anywhere from 28 to 41 initially. I had a Gleason score of 6 with 3 of 12 cores positive.
And your PSA was how high at the maximum?
41, and then it dropped to, this is before treatment, it bounced between 28 and 35 after.
What did you have, like 45 external beam treatments?
No, I had 5 of the gamma knife treatments.
Well, it's not gamma knife, because gamma knife
is cyberknife.
Yeah.
I had 5 of those, and now my prostate obviously is still there, and it's large. It's 90 grams, and I questioned the oncologist and said, since the gland is intact, would it not be putting out a lot of antigen and giving an elevated PSA? And what he told me was what he would judge is by the relative decline over the course.
Well, tell you, number one, thanks for your call, and I appreciate it very much. Number one, you're at very high risk. With a PSA of 40, you're at very